Hi guys, I'm Danny West and welcome back to another episode of the Soapbox, your patient education station. Today we're talking physio first aid for the upper neck. And this can relate to not only are you getting a sore upper neck, maybe even sore lower neck, but you might be getting some headaches lately. And that can be due to a lot of sitting at the computer, our chin pokey posture like we chatted about in episodes prior, and how if we get the upper neck moving better, moving well, it can actually start to not only decrease that tension in the upper neck, but also start to decrease maybe any headaches, again, if they're related to the upper neck. So I just wanted to go through a bit of anatomy first. So we have our spine here, and the neck is the upper kind of smaller joints. We have 7 vertebrae in the cervical spine, a fancy term for the neck. And up top here, kind of C1, C2 we would call it, is our upper neck, but also it pertains to the occiput, or the base of our skull, and how it sits on C1. So kind of as a really simple demo, I've had one of my cups here flipped upside down. So think of this as C1. C1 is kind of shaped like a bowl so that our head, or our bowling ball, can sit nicely in that bowl. And so when we're talking about upper neck, we need that bowl to kind of almost do a little bit of a roll when we do little baby chin tucks, and also when we do little side to sides. And notice this is more of a roll instead of a side bend, okay? So, and those are 2 different kind of neck functions that we want to kind of separate. Is not just how the neck moves as a whole, but how is the lower neck moving, how's the upper neck moving, and are they both moving sufficiently? And when we're talking about like cervicogenic headaches, so headaches relating to like neck dysfunction, it usually has to do with these upper joints, C1 and C2, and the occiput, or we'd call this joint here the atlanto-occipital joint, not moving well. And what we have kind of, if we pictured kind of like tethers, little muscles that attach the occiput and C1 and 2, we would call those our suboccipitals. So they're just underneath the occiput, and those can get really tight as well, especially with this chin pokey posture. It will kind of jet the head forward, the upper cervical spine forward, and cause those little muscles up top to tighten up. So I want to go through a little range of motion assessment for upper neck range of motion, okay? And it's different than a regular neck screen. So if we were to just check the general range of motion with the neck, we would do flexion as forward, extension, side flexion, and rotation. That's checking the neck, or those 7 vertebrae, just as a family. But say I want to get a little bit more specific. Say this client has been having chronic headaches. I know they do desk work. They're talking to me in the clinic, kind of rounded shoulders and chin poking forward. I'm kind of going to want to go more towards upper neck and see what's going on there. So if we kind of look up against the wall, and this ends up being an exercise I have people do, so it's an assessment as well as an exercise, is shoulder blades are back, the back of my head is right up against the wall, and I'm going to try to isolate the movement of the upper neck. So atlanto-occipital joint, and kind of C1, C2. So see how I'm almost sending my chin back through my throat? The cue is like make a double chin. So that is assessing flexion of my little bowling ball in the bowl, okay? So the upper neck. And that can be quite hard, and as I'm doing that, I'm actually stretching out the little muscles at the very back of the neck, okay? And then extension, this is usually easy for people, and in fact, you'll have them go up against the wall, and even for me, see how like I'm kind of comfortable in a position where my chin's kind of angled up. This is technically neutral, and that is flexion, and that's like really hard for me to do. I can just tell it's really tight. And again, if you spend time at the computer, if you're on your phone a lot, we're constantly jetting our chin forward, kind of sitting in a little bit of extension of that upper neck, so it gets quite tight. So we need to teach it how to go the other way. And as we're doing the movement, we're loosening those muscles. Now, the second movement we can test is instead of side bending, see, I'm almost like moving my whole neck as a piece. I actually want to picture like my head is on a skewer through my nose. Now, if I do that, I'm off the skewer. So I have to keep a little bit of a chin tuck, so I'm starting in neutral, and now I'm going to try to side bend by pivoting from this invisible dowel here. And I don't know if you can tell, this way I'm much better at, this way I'm sticky. So this cue, it doesn't let the rest of the neck kind of cheat the movement for me, because the body will go with the path of least resistance. So if the upper neck's tight, the body's really resilient, really adaptive, it's going to cheat by using other parts of the spine to kind of do that movement for you. The other thing you might see is as people try to do this, they're going to start to rotate. And again, that's just telling me, okay, we don't have really good mobility up through that upper neck. So I'm going to want to focus my treatment or self-treatment to more the upper neck, again, just to get a bit more specific. So with the upper neck, we're looking at, can I do the chin tuckies? Okay, and I would practice that too. So right up against the wall, trying to make a double chin, and I'm not going to let myself come back to here. That's my resting posture. I'm going to go from neutral into the chin tucky, just for a little practice, try to isolate that upper joint. Then the second thing, I'm going to find neutral. Okay, so where I'm kind of like right in the center here. I'm going to, and I find I have to hold a pen or like I'll point my finger, and I'm going to try to tip my ear to my shoulder. So I'm pivoting, I'm not side bending. Okay? Also, with the pen, if I start to rotate, I lose contact. Okay? So try to keep your nose in line with the pen, and try little baby side bends. Maybe try 10 to one side, and I'm going to do 10 to the other side. And just notice, like, this way is so easy for me, and when I try to go this way, I just feel a little pull, like up and through the left, right at the base of the skull. That's kind of my left suboccipitals, which might be kind of tight. So if you have like a pencil at home with like the rubber eraser, I'm just going to use my pen, you can actually, obviously not the pen side, the dull side, you can try to trigger point right up at the base of the skull. Those little suboccipitals kind of feels good. I'm just going to kind of hold it there. It's a way to kind of get specific. Again, I'm up top, I'm not down in the neck, okay? I'm like right in my hairline. Now, if you're like, I don't know what I'm doing with this, I look ridiculous, here's a really easy way you can do more of a general release, is you can use the foam roller, which I'm going to show you. And the other hack is, if the foam roller wasn't quite enough, I've taped 2 tennis balls together, and so I'm going to rest kind of the base of my skull here, and I can actually trigger point those suboccipitals using the little peanut tennis balls. So I'm going to show you the really easy upper neck release. So I'm going to lie down, and I'm going to get right up under the base of my skull, okay? And I'm just going to start to rock back and forth. And you can kind of play with the angle here, but I like this one because it kind of puts my chin into that tucked position. So it doesn't let me sit in that extended position that I like. But you can rock back and forth. If you get to a little sweet spot, you can just kind of hold it and breathe. Like I said, if you wanted a different kind of pressure, you can try the little tennis ball peanut. So I'm gonna place it under. And this is like right up top, folks, like right into the hairline. And again, you can just kind of like find that sweet spot and just kind of hold it. And you could even try some of your little chin tucks. And for me, I'm just gonna kind of trigger point more the left. And I'm just holding and waiting until it eases off. Once I've tried that little release, I'm going to come back to my wall exercise. I'll get my pen. Little chin tucks, and that even feels a bit freer already. About 10, and that feels freer. And again, I'm trying to pivot from the nose. Still a little tight up there, but you can see I get a bit more range of motion. After kind of like the movement assessment, do that first. See which side you feel a little bit more pulley with. Try your release work. Try to trigger point maybe more the side that felt tighter. Like when I went this way, I felt the pull on my left. So I kind of tried to release more the left. And then always, always, always retest, okay, to see, okay, does this feel a little bit freer than it just did? And then my side tips, okay? And again, use your finger, use something you can pivot around just to make sure you're not cheating into rotation or side bending. Try that consistently. When you're at your desk, try not to sit kind of chin poked forward. Almost picture like the wall or a headrest behind you, or if you're driving, find the headrest, give that little baby chin tuck to kind of lengthen the back of the neck, and do that consistently. Do your little upper neck mobilizations, your release work, and then see, does it start to dissipate my headaches a little bit? Because again, if the upper neck's not moving well, you can get those tension headaches and just start getting really achy kind of upper neck and right at the base of the skull. Okay, so that's your physio first aid for the upper neck. No chin pokey posture, and get working on your little chin tuckies and your pivots. Okay, thanks guys, see you next time.